My name is Zarig Cooper, and along with my wife Connie, we have been studying with Andrew for probably about 12 years now, from when he first came to London and taught his syllabus of all the education and all the information he likes to teach. So he taught us the orthopedic series, he taught us the internal medicine series, he taught us a bodywork series, he also taught some philosophy in the Tao Te Ching series. After he taught that in London, he's stopped coming to London as much, and Connie and I took the opportunity to go to visit him in his clinic in Asheville in the US, where we've trained with him every year, assisting him in various other seminars, all for the purpose of building our knowledge and skills so that we can pass on some of that information and that knowledge to people in the UK again. And the last couple of years, Connie and I have been teaching one day seminars or weekend seminars on various things. So we've taught lots of needle technique, we've taught short weekends on orthopedic acupuncture, and they've gone really, really well. And coming up in October, we're launching the 5 module series of tangible acupuncture for orthopedic injuries, which is the module Andrew taught initially in the UK. And we're really excited about teaching that because it hasn't been taught in the UK since he did it over 10 years ago in this form. And although he's not teaching in person, he's very much collaborating with us because he's giving us access to the 40 plus hours of video of him lecturing and discussing orthopedic acupuncture. So this course is quite exciting for us to teach, the tangible acupuncture for orthopedic injuries. We will be focusing on aspects of diagnosis from a classical Chinese perspective, sinew channels, tendo channels, observation of patients, palpation of patients, quality of touch is really, really important. We're going to be training people in that quality of touch, both with needles and with our hands, and introducing people probably maybe for the first time on how to develop their touch through internal Daoyin practices. This is an essential part of being able to treat and to diagnose. Obviously, we're working on body areas, different body areas, and injuries. So we're going to cover obviously backs, shoulders, knees, elbows, things like that. But probably most importantly are the variety of techniques that we'll introduce. Again, maybe for the first time for some people, techniques such as spiral picking or spreading or gathering chi to an area, all different ways of manipulating the landscape of chi on a patient, um, depending on their constitution and their ability to change. I mean, it's our job as practitioners to make change in a body, in a patient, and we have to understand how much of that change to try and achieve in a session, because some of these techniques are challenging is the right word. It doesn't have to be that they are too challenging. We do want to make change to a patient, and we have to learn how to be very gentle and very subtle, and yet very effective and focused. Um, so we are going to look at different types of patients, different ages of patients, different constitutions of patients, learn what's appropriate, and learn what's most effective to apply. So this course, the tangible acupuncture for orthopedic injuries, is a great opportunity to take your learning that you have already, and it can be from any system that you've learned already. It doesn't conflict with what you've learned, but it's an opportunity to move into an area of treatment which is genuinely effective. It's tangibly effective, and it can be added to whatever system that you use already. So we're really talking about clinical effectiveness here. Um, it's the ability to treat patients that come to you with a pain condition or related pain condition that might be as simple as a stiff neck, or it might be as complicated as spondylolisthesis in the back, or it might be something post-operative that someone is struggling with for many, many years. Whatever that comes in to your clinic, if you don't feel like you have the knowledge to approach that from a Chinese classical perspective, if you don't feel like, if you have a gap in your knowledge that which makes you uncertain about what it is you need to do for that person to help them get out of pain, then where do you turn? I mean, I believe that this course directly fits into that gap where you will learn skills, practical skills, which you can apply immediately. They require some training and they require some practice to get better at, but there's something you can apply immediately after learning them, which gives you the ability to fill the gap and provide your patients with um, an approach which is effective and tangible. If you sign up to the course by the 15th of August, you can get a £100 discount. That's an early bird price of total £1,650 for the 5 weekends, 10 teaching days, and including the 40 hours of Andrew Nugent-Head's lectures. After the 15th of August, the early bird price does not apply, and you'll be paying £1,750 for the course.